Hello and welcome to Mature Matters. My name is Debbie Clark and I am here with Kelly Helpe. She's an occupational therapist from Botsford Hospital, and we're going to be talking about lymphedema, which is an issue that can occur from swelling, and she's going to give us some good information about that. Let me just let you know Kelly's background. She is an occupational therapist. She graduated from Western Michigan University with a bachelor's degree in 2003. She achieved her master's degree in 2004, and she's been with Botsford for 9.5 years, and she currently is the occupational therapist coordinator. She was lymphedema certified in 2006 and LSVT BIG certification in 2013, and that is a research-based Parkinson's exercise program that we have at the hospital as well. Welcome, Kelly.
Thank you
so much for taking time out of your busy day.
Thank you.
Yes, so have some questions here for you, and we just want to have our audience to become aware of the specialty programs that Botsford Hospital does offer. And lymphedema is the title. Could you just let us know what exactly lymphedema is?
Sure. Lymphedema is swelling of an extremity, most commonly an arm or a leg. It can travel into the trunk and neck, but the majority of the patients that we see are just arm or leg swelling. And basically, it's a disruption in the lymphatic system, which prevents lymphatic fluid from moving back into the circulatory system.
I see. And also, with lymphedema, it has to do with swelling, correct?
Right.
Would someone need to be concerned if they were just swelling from eating too much salt, or you know how on hot days your fingers and your feet will swell? Do we need to be concerned with that?
Well, someone who has lymphedema, the swelling in a normal person, when you fly or when you go out in hot weather or if you eat too much salt, your body naturally is going to swell. In a person who doesn't have lymphedema, that swelling eventually goes away.
Right.
With someone who will have an issue with their lymphatic system, that swelling doesn't go away.
I see.
It continues to persist, and even after, typically my patients say, well, I've had swelling for 2 or 3 years, and it's just gotten to the point where the swelling doesn't go down. Because typically patients will go about their day. Toward the end of the day, they notice some swelling in their legs, and then they go to bed, their legs are elevated, they wake up in the morning, and their legs are back down to the normal size. What they don't really realize, though, is that there's a little bit of fluid still building up in their arm or their leg. And it will get to a point where it just gets to a point of capacity and the leg does not go down or the arm does not go down, and that's when they usually go to a doctor and say, oh, I think there's something wrong. And so it's those people where if they eat too much salt or if they go out on a hot day, they're going to see swelling that does not go down.
I see. And would that person who the swelling does not go down, would they experience pain or anything that goes along with that swelling?
You can. Some patients have pain, some don't. It really depends on the person.
I see. Interesting. Can anyone get lymphedema?
Well, there are 2 types of lymphedema. The first type is called primary lymphedema. That type of lymphedema patients are usually born with in men and women. The secondary lymphedema is a type of lymphedema that you get from trauma, surgery, something called venous insufficiency, and so that's the secondary type of lymphedema.
So if a person who had breast surgery, such as a lumpectomy or a mastectomy, and if they end up having, some of the lymph nodes removed, they may have that lymphedema.
Yes.
And should be concerned about that?
Yes, that is a huge part of the lymphedema population, is men and women who have breast cancer, prostate cancer, where they have the clusters of lymph nodes in the armpit removed or in the groin area removed. And nowadays, the great thing with modern medicine is that there's a test that can be done that shows if the cancer has traveled into the lymphatic system, and they can specify how many lymph nodes it has affected. Where years ago they just took out a whole cluster and hoped for the best. Where nowadays, they can really specify which lymph nodes are affected and just take out that little bit. Now, with that said, even if it's just one lymph node or if it's 14 lymph nodes, you do have the chance and the likelihood of swelling in that extremity, because in a normal person, for instance, you have this much your lymph nodes and the fluid can go through. When you have lymph nodes taken out, it can be maybe this much, and so that slows the amount of fluid moving back into your circulatory system.
Oh, wow. Interesting. Who would benefit from this program?
Anyone that has swelling or has seen a physician and has a venous insufficiency diagnosis or a lymphedema diagnosis.
So if someone notices that they have swelling that doesn't go away, they could tell their doctor, and would they need a prescription to have an evaluation from a qualified certified lymphedema therapist?
We in Michigan do not have direct access, so we do need a prescription from a physician in order to treat anyone, including lymphedema. And I've seen patients from oncologists, podiatrists, family practice, internists. It doesn't really matter what type of doctor that you go to. I've seen patients who have had breast cancer 15, 20 years ago, and their oncologists, they don't even know anymore because the breast cancer is gone, and but all of a sudden they have swelling in their arm, so they go to their primary doctor, and I can easily see them with a prescription from a primary doctor.
Right, and based on the prescription, if a person was given a prescription, how long is that prescription good for before they go and make an evaluation with a therapist?
It's best to contact a rehab site as soon as possible, because prescriptions are only good for 30 days. If you go past that 30 days, then you do have to return to your physician and get a new one. Now, with that said, if you do not get into therapy for 2 to 3 weeks, that's okay. Most therapists can easily get another prescription from the physician.
I see. So when they get the prescription, they make their first appointment with you. What can that patient expect?
Well, the first day we do a comprehensive history on when they notice the swelling, does it come and go, do they have pain, are they limited in range of motion or strength or activities of daily living. And so after we get that history, we also take measurements of the swollen extremity and the non-swollen extremity to get a comparison. And so that way we can show improvement when we reassess them down the road. And so we take measurements with just a basic tape measure, and we use a special evaluation, so we measure the same points every single time.
I see.
And then from that day, we also usually send them home with the exercise program where they start doing things at home also, and then we start the treatment.
Right. So you had said that you would do a comprehensive background and you would do a measurement in a home program. How does the swelling stay away once you do your treatment?
Well,
what do you do?
We typically see patients 2 to 3 times a week for a month before we reassess. Sometimes I see patients for longer than that. It just depends on how their body reacts to the type of treatment.
Sure.
The type of treatment consists of 4 different parts. The first part is a type of massage that we do. We're not certified massage therapists, but we are trained in lymphatic massage, which is much different than going to a spa and having a deep tissue massage. The lymphatic system is just under your skin, and so it's a very soft type of massage so that you're moving fluid away from the extremity back into the circulatory system. And So that's the first component. The second component is exercise, very simple range of motion exercises, including the trunk, the neck, the head, the legs. The third component is compression bandages. Now, in order to keep the swelling out of the extremity, once they've left us for the hour-long or 45-minute-long treatment, in order to prevent refill into that extremity, we do compression bandages.
I see.
So what we do, these look like ACE bandages, but they're not. These are Comprolin compression bandages that have a lot less elasticity.
Oh yeah, I see that.
And so it provides equal compression up the arm or the leg, preventing refill for when they go home. Now, the compression bandages are not something that you will wear for the rest of your life. From there, you typically move on to a compression garment, which you can use on the arm or on the leg, such as stockings. And this is something that you do want to use or wear for the long term.
It's got a nice design.
Yes.
Can you put it on so we can see?
Sure. This is, they used to come just in this brown, boring color, but nowadays they have different designs, if you wish, different colors, diamonds. Nice. This does go all the way up the arm. And this is a nice tattoo design that I have here. And so, nowadays, women and men, want something that's going to look a little bit nicer. So I think that's why certain companies have come up with these designed ones.
Very cool.
And the fourth component of the treatment is a home exercise program in which the patient does at home, which includes the exercises and then also a type of massage that they can do at home to stimulate the lymph nodes and get things draining a little bit better.
Wow. The next question is, can any therapist do this lymphedema treatment?
Well, this, you have to be a physical or occupational therapist or an assistant, and this type of treatment is actually done by a certified lymphedema therapist. So this was separate from my schooling. I had to go to a separate certification course and learn this. It can range, I think some courses are 3 days, 4 days. I took a week-long course where you learn everything about the lymphatic system and the treatment and everything. So you do have to be a certified lymphedema therapist.
Now, did you have to take a test at the end of your week?
I did. You take a test and you do a practical where you demonstrate the techniques that you have learned on fellow classmates, and the teachers and professors come around and make sure that you're doing it all correctly.
So it definitely is a specialty field.
Mm-hmm.
How long would the patient expect to be in therapy? You may have answered that, but I didn't catch it.
Mm-hmm. It depends on how well the patient's lymphatic system is reacting to the treatment. Typically, we see patients for about 30 days before we reassess them. And at that 30 days, if they've made improvements, and depending on if they still have swelling or not, if they do, depending on the insurance, we can continue them on. And some of my patients, that 30 days is good. They may have not started with a lot of swelling, but or their body reacted well and they did their home exercise program and kept up with everything, and they can get out in 3 to 4 weeks.
Right. So if I were a physician watching this show, what would they expect from you as a therapist? Maybe in documentation, or how often would you get information to them to see how the patient's progress is?
We typically send them our evaluation, which includes all of their measurements and what our goals are for the patient. And then usually not until the reassessment, which is typically 30 days or 10 visits. Now, some therapists do measurements in between that time. If a patient wants to really see how they're progressing, we might take some quick measurements throughout the treatments to see how things are going. And any physician can easily call and say, hey, how's so-and-so doing? How's the measurements coming? Could you send me daily notes? And that's perfectly fine too.
Right. Well, that's good. And also the results of the therapy.
Mm-hmm. The results of the therapy, ultimately, we
goals.
want to get the swelling down. And like I mentioned before, a lot of times the swelling affects range of motion. It affects being able to, put on a shirt. It can be painful, and walking and standing for long periods of time is difficult for patients who have lower extremity swelling. And so our main goal is to reduce the swelling, and in turn that increases the range of motion, that decreases pain, it increases the ability to do things on a day-to-day basis. And so those are all of our goals, and ultimately the patients also.
Right, I can see that. Really, the only other thing I think that people may ask is, do most insurance companies cover this?
Well, lymphedema, it's a specialty, but it's
Right.
done by a physical and occupational therapist. And so as long as your insurance covers for physical or occupational therapy, then yes, the insurance will cover lymphedema treatment, because technically there's no specialty code or anything like that. It's just rehab.
Sounds very beneficial for the patient. There really isn't anything else that I can think of. Is there anything that you might want the community or our viewers to know about the lymphedema further? I'm not thinking of anything else right now that...
I think we covered most of all the aspects. Botsford Hospital does have lymphedema therapists at every single clinic, including the on-site clinic and our off-site clinics. And so if someone thinks that they might have swelling that does not go away, contact the doctor and then give us a call to get evaluated.
Sounds very, very beneficial. Well, Kelly, I want to thank you so much for taking time out to explain to us about lymphedema, and we hope to see maybe somebody from your staff. We're going to be having some other highlights of specialty programs. I understand that there's 8 different ones, and they do offer the physical, occupational, and speech therapy. The traditional therapies is what you mentioned, so we're very thankful for their part in the community. And at this time, we'd like to say thank you, and we'll see you soon.